So NACHC for me is this wonderful place that I probably get more from than I give, although I think that's probably the reason why it's been really a thrill that my colleagues have elected me to the board. I find that at NACHC I get that kind of shot in the arm that keeps me going, and it happens twice a year at CHI and PNI, and I've been really fortunate that I work for organizations that are able to support my participation. The information that I get keeps me involved at a policy level and helps to explain to me and to my colleagues the reasons why it's so important to do what we do on a daily basis, and the reasons why sometimes it's so difficult to do what we do on a daily basis. And that really goes a long way. The other thing that happens when I come to meetings is I get smart and I learn things. And probably some of my most brilliant ideas have been things that I've learned in sessions at NACHC. And I come home and I send some emails and do some web searches, and our health center benefits. Well, over the years, what I found NACHC has really been wonderful at in terms of their trainings is really kind of pushing the envelope and giving me a preview of what I should get ready to be able to do before I really have to do it. And so in some ways I get the benefit of maybe that crystal ball that everyone always says, well, if I had a crystal ball, and in some ways I feel like I do. I come to NACHC and I get the opportunity in the clinical practice committee to interact with folks from the clinical division of the Bureau of Primary Health Care, and they tell us what are the priorities that are coming up for the near future and what are some of the areas that on the federal side they're wanting us to pay more attention to. And so in some ways I get a little bit of runway so that I can prepare my health center for how we're going to respond to some of those things before we're in the thick of it and have to do it just like that. So when you come to NACHC, and actually even when you're not at a NACHC meeting, you have available to you this resource to help you in your day-to-day work. And I think a good example for me is when we were first starting on that road of getting our patient-centered medical home recognition at our health center, and there was one particular area that I knew we didn't have it, and we were really starting from scratch. And I called up one of the NACHC staff and I said, what do I do? And he said, well, here are the health centers around the country that are doing really well with that. And these happened to be people who I knew because I had met them at conferences. And so it was really very easy just to shoot off an email and say, hey, remember me? I met you at a conference and I'm working on this PCMH standard, and I heard you've done great work in your health center on it. Can you tell us how you did it? And several conference calls ensued. My team at the health center was so impressed that I had these connections. And we were able to build some infrastructure and systems that are really going to help us give better care to our patients.